You've just seen what the psychological interventions of ADHD are, and more particularly, that their goals in general is to target the executive functions which are globally impaired in this disorder. We will now try to understand why these interventions are important. Indeed, since the drug works so well, why bother going to psychotherapy sessions? There are several answers to this. First of all, as you saw in Module 2, there are psychiatric comorbidities with ADHD, other disorders that complicate the life of the person with ADHD, such as depression, anxiety disorders, and so on. And although drug treatments work well for ADHD, they do not help to treat the comorbidities and the social and functional consequences of them. It will therefore be necessary to find other solutions to reduce the psychological and behavioral consequences of these comorbidities. Second point, even if the drugs work well, follow-up studies have shown that more than half of the patients stop their medication after a few years without necessarily having learned strategies to overcome their difficulties. There are many reasons for stopping treatment, but the main ones are side effects or the lack of optimal efficacy. Therefore, the guidelines that you've seen in Module 2 propose to add a non-pharmacological approach to drug treatment, such as psychological interventions, targeting above all patients for whom symptoms persist although medication has been established. Furthermore, the drugs have not been shown to have any long-term benefit once the medication is stopped. We must therefore find other options for long-term treatment of patients with ADHD, and psychological approaches could perfectly meet this need. Another point is that not all patients or parents of ADHD children want drug treatment for their own reasons. It is therefore necessary to be able to offer them alternatives. Finally, the majority, this is even more true in adults, will have difficulty regulating their emotions, and medication have little or no effect on this emotional dimension of the disorder. It is therefore important to offer patients strategies that allow them to regulate their emotions independently of medication. And the psychological approaches, do they work or not then? Yes, studies have shown in all age groups that psychological approaches, and more particularly those of cognitive behavioral inspiration, including mindfulness approaches, have an effect on ADHD symptoms, not only self-reported, so it is the individual himself who says that it works, than observed by a third party. It is a relative who observes that it works. These approaches work on the symptoms of inattention, hyperactivity, and impulsivity. Depending on the areas targeted, we observe more specific impact. For example, if we work on time management, organization, and planning, it is in these areas that we'll have the most impact. It makes sense. Where these approaches also seems to have an interest is on the secondary symptoms of difficulties of ADHD, such as interpersonal difficulties, functional impairment, self-esteem, regulation of emotion, with, in particular, a decrease in anger, feelings of frustration, and the negative emotions of depression and anxiety. Finally, they will help to treat the psychiatric comorbidities of ADHD because the strategies learned in these psychological approaches, if they are useful for ADHD, will also be useful for all other psychiatric disorders. It would also seem that psychological approaches have a functional and structural impact on the brain, especially in the frontoparietal regions. These regions are the same as those modified when taking medication. Another important point concerning families with a child suffering from ADHD is that psychological approaches aimed at parents, so psychoeducation, skills training, and so on, have a positive effect on the child's symptoms and improve functioning of the whole family. Finally, and this is one of the advantages of drug approaches, the effect seems to persist for several months or even years after stopping treatment. So, does it work without medication? Yes, although the effect is modest. Recent studies tend to show that these psychological approaches work even in the absence of medication. You will see in the next video how these therapies work, but very briefly, we know that part of the effect lies in the psychoeducation aspects and in the fact that we target quite specifically such and such areas of the disorder. However, psychological approaches have the best effect when combined with drug treatment. The combination of the two is indeed more effective than either of the two approaches taken separately, whether on the cardinal symptoms of the disorder or on general functioning or even on the symptoms or secondary consequences of ADHD. I hope you've understood that psychological approaches to ADHD are important for several reasons. The main one being the acquisition of skills and strategies that are sustainable over time, which will allow the individual to function in the long term with their ADHD, whether or not it takes medication. You will also note that the combination of drugs plus psychological approaches is the best strategy to adopt if you want to have the best effects on the symptoms.